The spiritual assessment. For the purposes of this podcast, be sure that you have listened to the previous podcast entitled Doing a Spiritual Assessment. That little role play is an introduction to this podcast. The recorded Doing a Spiritual Assessment role play only lasts about 4 minutes, and that's just about all it takes to do a spiritual assessment with a patient in a real clinical setting. The spiritual assessment gives a sense of whether spirituality is helping or hurting this patient. It is possible for people to have wrong ideas about spirituality, religion, and for spirituality to actually be causing the patient more harm than it is doing the patient any good. Some patients are sick because of their unhealthy spirituality. The loss of meaning, the misunderstandings about the nature of God and the nature of humanity can be the very reason why the person is having the difficulties that they're having. But spirituality can also be very helpful to the patient. It can be health-giving, and it can help the patient to recover. The purpose of doing a spiritual assessment is, of course, to understand the resources that are available to the patient for getting well. Physical resources, mental resources, emotional resources, social and spiritual resources. The purpose of taking a history at all is, of course, to understand the patient's present complaint. And beyond that, to understand the patient in all of his or her dimensions. What is it about the patient's family that might be contributing to this present complaint? What is it about the patient's history, health practices, lifestyle that might be contributing? What is it about the way the patient has lived, or where the patient has gone, or people that the patient has come into contact with? If the patient, for example, has recently been in the tropics, then the physician might suspect some kind of exotic tropical disease. Or if the patient has worked with infected animals, that might be light to bear on the nature of the patient's present complaint, and so on. So a good diagnostician is going to extract from the patient as complete a history as possible in order to understand the patient in all of his or her many dimensions. And of course, another purpose is to assess the patient's resources for health. What does this patient have going for them that will help them to stay well, to be well, or if they're already ill or injured, to get well? I'd like to present to you two different models of wellness here. One is a pathogenic model. You probably know the term patho already. It has to do with illness, sickness. And genic, of course, comes from the Greek word, like Genesis, what is the beginning of a person's illness, versus a salutogenic model. This is a model proposed by Antonovsky, in which he looks not at what it is that makes a patient sick, but what it is that makes a patient well. What are the causes of health? Pathogenic, again, what makes for illness? Salutogenic asks the question, what makes for health? Pathogenic medicine attempts to find out what it is that is making the patient sick and remove it or fix it. Salutogenic medicine attempts to find out what resources the patient has for health and to enhance and supplement and build on those resources. These resources take different forms, as you already know from our analysis of the human being as a bio-psycho-social spiritual unity. Some of these resources are physical resources: strength, health, vitality, immunity. Does the patient eat a good diet? Do they take vitamins? Do they drink enough water? Are they the right weight for their body frame? And those kinds of things. Mental resources. Does this person think well? Does this person understand accurately what makes for health and what the nature of their present complaint is and how to think about it? Do they have understanding? Emotional resources. Some people are on the negative side of psychology. That is to say, they're dealing with mental distress or mental illness, possibly serious mental illness, and that's taking a certain toll upon them. And they're experiencing a lot of negative emotions. Other people are on the positive side of psychology, and they're experiencing mostly positive emotions, and they have a lot of resources in that realm that they can bring to bear on getting well. Social resources. What kind of support do they have? Do they have a loving spouse? Do they have a happy family? Do they have attentive parents? Do they have a good family that cares for them? Are they connected to friends and social support structures? And then, of course, there are spiritual resources. Does this person experience a sense of meaning in life? Does this person have a sense of purpose? Does this person do trust easily? Are they resilient, able to spring back from adversity? Do they approach life from an optimistic or a pessimistic point of view?